And to kick us off, we have a very esteemed professor from UC Berkeley. He's worked relentlessly for decades on issues like water, issues like energy, building efficiency. He's been at many of the research labs here in the United States. So I really want to kick off this whole session for the Eastern Hemisphere with Professor Ashok Gadgil. So, Professor, please welcome and please make your remarks.
Thank you very much, Mark. It's a great honor to be invited to be a keynote speaker here at this distinguished forum. I would like to share slides. So let me see. Oh, it's not turned on here. I'm going to send a request. And good. Now it is on. Let me see how it goes. Right, in a second. All right, here we go. Oh, seems to have a slight glitch there. Give me a second to understand what is going on. Yeah, here we are. Let's start sharing. Go to full screen. Okay. I hope everybody can see that. And I understand from MR's remarks that not everybody is on Zoom, so maybe not everybody can read the slides, but that's not central to the talk. I'm going to talk very briefly about the deadliest annual Indian environmental disaster. And it's here already. But before I launch into the details, I want to thank the India Energy and Climate Center, and especially thanks to my collaborators here, Piyush Narang, Elif Kilik, Rohini Tamarana, and Shruti Dera. Oops, here we go. So heat waves in India are bad, and they're getting worse. And it's the single deadliest climate-linked disaster that happens annually, as we will see. 3 of the 5 warmest years occurred just between 2015 and 24. They are projected to become more and more intense and more frequent as the century progresses. Even if we meet the target of 2 degrees Celsius by end of this century, some estimates show that the heat waves in India would become 30 times more frequent. And the mortality numbers, by which that is the basis for calling this the worst environmental disaster. The mortality numbers are vastly underreported and misclassified, which is leading to also misallocated resources and missed opportunities to get ready year-round, so that we don't have to count our heat waves in India as our worst disaster of any kind. First things first, to remove all doubt, Indians are not bulletproof to heat. I get that whenever I talk about heat susceptibility, and people tell me, oh, we lived with the summer heat for hundreds of years. We know how to do this. We don't know how to do this, okay? In spite of having lived with our kind of heat, healthy, normal body temperature, core temperature, is 37 degrees Celsius, whether you are an Eskimo or whether you are living in Rajasthan. Even for many centuries, doesn't matter, okay? As the heat load on the body goes up because of high external temperature and high humidity, so you can't cool yourself by sweating, elevated core temperature below 30 degrees Celsius, below 40 Celsius, can be just below 40, it still leads to exhaustion, confusion, and dizziness. At 42, there is organ damage and coma. At 44, leads to heat death. And that applies to anybody and everybody, so long as you are 37 cells, human being, normal human being. But most Indians are highly vulnerable. And that's because only 8% Indians have access to mechanical cooling. By that, I mean actually vapor compression or some kind of modern cooling method. And 48% of our workforce, close to 300 million people, were exposed to outdoors with jobs in that list that I show on the screen, agriculture and construction and so on, which means that they can't even go indoors. And lastly, very large populous areas of India are predicted to become uninhabitable in the summers by the latter half of this century. So the heat migration in India is expected to be on the order of 600 million people. It's unimaginable what is going to happen there, but we got to do something about today, not about something in the latter half of this century. So look at heat mortality totals. Let's look at the official numbers. And the National Crime Records Bureau for 20 years adds up to about 20,000 heat stroke deaths. The National Disaster Management Authority reports 17,000 deaths over 20 years. India Meteorological Department reports 10,500 deaths. So slightly different counts, slightly different methods of accounting, slightly different frameworks, but broadly speaking, about 16,000 official heat-related deaths in past 20 years, which means about 800 deaths per year from heat. That's worthwhile to remember that number because we are going to estimate it some other way. And in 2023, just 2 years ago, the media reports recorded about 700 deaths, not too far away from about 800. And Ministry of Health and Family Welfare reported 360 deaths in a response to a parliamentary question. So the annual death count from heat is tiny. That's about 800. Compared to the daily all-cause mortality in India, that's about 25,000 per day. So what are we getting upset about? Okay, put it in context, right? Sure, the trouble is those estimates of 800 are way, way wrong. And the reason is that, think of it like this. When a death occurs, there is some forensic evidence or a coroner's report about why the person died. And then the death gets counted, attributed to that cause. Somebody was mauled by a tiger and eaten alive or whatever, or died of drowning. The evidence is very clear. There are clear markers on the dead body. However, there are some environmental threats that don't leave a clear distinguishing mark. For example, urban air pollution. If you look at the World Health Organization's reports about how many people around the world die from urban air pollution, the number is about 4 million people per year. And that's not because they do an autopsy on 4 million people and find something in the body that says, aha, this person died from urban air pollution. They do a statistical analysis of how many people die per day in a given region when the air is normal and clear versus what is the incremental death rate when there is a high air pollution incident. And you can't tell statistically which person actually died precisely and attributed. Okay, what you have, there's no data marker, but you have a baseline to find out what is going on. So the very first paper ever that analyzed the increase in all-cause mortality from heat waves over the 10 years of 2008 to 2019, that paper appears in 2024. And there also they could not get all of India's daily mortality data, but they could get from the municipal records the daily mortality data for 10 Indian cities, which are listed on the screen. And they analyze the data in multiple ways to extract the bump in the mortality during the heat wave days compared to the background mortality. So you can't tell which particular individual died, but we do know that whenever the temperature exceeded 97th percentile of the daily mean temperature on 2 consecutive days, here was a bump in mortality. And these bumps are different. There is a smaller bump in Shimla compared to Kolkata. But they do all of that analysis very, very carefully. Paper is public domain. Anybody can look it up on scholar.google.com. So that forms the foundation for us of building on the 10 cities work and extrapolating those numbers for those bumps to 700 plus districts of India using Köppen-Geiger zones, climate zones. And then we match each of the districts to one unique city out of the 10 selected by debunked. And then we apply the city-specific excess mortality coefficients to those districts, straightforward, multiply by the population, taking into account that we are ignoring that the rural people have poorer infrastructure, they have more outdoor jobs, they live under harsher conditions, have poorer health status, poorer economic status, and therefore likely have higher mortality rates. But we say, you know what, let's build a conservative number. Let's build an estimate as the minimum of how many people are dying from a heat wave in India. And then let's multiply that by how many heat waves we get. So here are the district assignments in the 10 cities in case you're interested. Color-coded map. Ignore, please, these 3 islands, 1, 2, and 3. They are graphical package mistakes. They are not in our spreadsheet, but we didn't have time to get the map exactly right. We'll fix that. Here is what the analysis looks like. It is organized by how many deaths, excess deaths occur, and the total excess deaths at the 97th percentile temperature. I hope you can see my cursor. For a 5-day heat wave, is about 30,000 excess deaths, added up by all these rows and rows and rows. So 1 5-day heat wave, the excess mortality is 30,000. Assuming 5 such heat waves, they don't have to occur simultaneously across India, but any given location, on average, let us say there are 5. People say between 5 and 6, okay? Leads to about 150,000 excess deaths. Every year, reliably. And the number is going up and up because these are older numbers from 2008 to 18. And now we are in 2025, 26 going forward. Here are the worst hit states. Not a great surprise here. UP, Bihar, Rajasthan, Madhya Pradesh, and Gujarat. Here are the worst hit districts, 6 of them, the worst 6. Ahmedabad, Jaipur, Surat, Prayagraj, Patna, Lucknow, and Kanpur. If you multiply the excess mortality bump by the population of the district, you actually get the district level mortality, which is here in the box, ranging all the way to the high of 150 to 300 for the darkest red, which happens in central India and some places in UP as well. They need urgent attention, in short. Is the single largest annual disaster of any kind. No bridge collapse, no train accident, no building collapse or nothing comes close to something as predictable as this. It is hugely misunderstood, miscalculated, and mostly ignored. Anticipatory and data-driven heat adaptation is urgently needed, and I'll come to that in a second. Evidence is available for what works and what doesn't work to reduce heat deaths. And it's a silent disaster because people pop off, they die quietly, being written up as somebody died of heart attack or somebody died of God knows what other cause. But really, they are dying of heat deaths. And at discussion time, I can tell you why this happens. And lastly, we have district level granularity of insight, so targeted actions are possible. So what can be done right away? Okay, we need heat action plans in rural and high-risk districts. And many districts have taken that step so that you decide what needs to be done and prepare for what is coming. This is already mid-April, past mid-April, and temperatures are already exceeded 40 degrees Celsius in central India. Indore, for example, was 42. We need aggressive public outreach for awareness about hydration, about outdoor work, muscular labor, hard labor that raises core temperature because of higher metabolic heat production, heat illness and heat stroke, how to recognize it, how to avoid outdoor labor in sunlight in the hottest part of the day, and about hydration. We need to make easy access for ice slurry, oral rehydration salts, emergency medical care. We need cooling shelters. We need to adjust school hours and work hours. And we must integrate heat waves into disaster management planning. Because if not this, then what are we preparing for? This is really urgent and it's ready for action. And this is at IECC, India Energy and Climate Center in Berkeley. We are engaging in all the above actions to the extent possible, in particularly working with NDMA, National Disaster Management Agency, and other Indian agencies. And this is where I will stop and take questions. Thank you very much.
Thank you, Dr. Gadgil, for that brutally eye-opening presentation. As somebody who lives in Delhi, I can assure you that the heat becomes intolerable towards May. And I mean, this is a personal anecdote. Even last year, a lot of us were falling sick, and the doctors attributed it to some viral infection. There was only just one doctor who said this could be down to heat illness. So yeah, this is actually a big thing. There's one question I have posted by somebody, one of our attendees. So is there any similar study conducted for any Gulf countries? Because Gulf countries also have extreme summer, and a lot of Indians work in the Gulf countries.
Right. I'm not aware of it only because I'm not looking for it. I'm sure there are scientists around the world who are looking at this very closely, but there is a gap between the publication in scientific journals and policy and action that needs to be closed. And I'm very sure that that work is underway, much like the work by DeBont and so on was done back in 1922-23 and got published in 24.
All right. I guess if there are any other questions that come up, we'll mail them to you so that you can
Sure.
answer them later. Thank you so much.
Sure.